My name is Morgan Hawks, and I'm going to be giving a persuasive speech about organ donation. Here are my 5 audience members. Okay, I want you to try to think about something you desperately want. Maybe a new cell phone, a car, or a new outfit. Now imagine that you had to be put on a waiting list and had to wait several months or even years before getting what you wanted. How does this make you feel? What if it was something you literally could not live without? At the end of June 2010, Trish Davison stated in the Gale Encyclopedia of Allied Health and Nursing that according to the United Network for Organ Sharing, about 108,000 people were awaiting donor organs. The number of patients waiting for organs far exceeds the number of people who have registered to become organ donors. If you were handed the opportunity to save someone's life, I hope that you all would take it. A few years ago, right here in our small community, a fragile 12-year-old girl was told she was in desperate need of a heart transplant. She was not even guaranteed her next 5 years of life due to her heart condition. This little girl was put on a waiting list for a heart, a vital organ that she could not live without. She had to live out her school days in a hospital room with little to no visitors. However, 2 years ago, the Riggs family received a phone call that they had found a match for this little girl and was planning for surgery immediately. It is so nice to know that someone out there decided to donate their organs before they passed away so that this little girl could have a second chance at life. Organ donation is a beautiful process. So if you're sitting here speculating how to become an organ donor and exactly what is organ donation, I may have some answers for you. I have extensively researched this topic and have found a lot of information about this program and how it works. In order for you to be well informed about organ donation and to make a decision whether or not to become an organ donor, you must first know exactly what organ donation is and how desperately new organ donors are needed. Also, I'm going to tell you how organ donor recipients benefit from your organ donations, as well as how to ultimately become a lifesaver and what organs and tissues can be donated. According to the Sunday Tribune, How to Become an Organ Donor, there are different types of organ donations. The 2 types of organ donations are living donations and donations after death. Living donation is less common and usually, but not always, the person who donates is biologically related to the recipient. You have to be a perfect match in order to go through with the living donation. Only organs that someone can live without may be donated to the organ recipient. Donation after death is when you specify to your family or have an indicator on your license for your wishes to donate your organs once you have passed away. According to Trish Davidson, we learned that all organ donations in the United States are regulated by the United Network for Organ Sharing. Organ donation takes healthy organs and tissues from one person for transplantation into another. A transplant is usually the last course of action in the treatment of a patient, but if the patient consents to an organ transplant, doctors put the patient's name on a recipient waiting list. Meanwhile, organ donors who have consented in donating their organs and tissues have been approved by the UNOS. They are placed on the donor waiting list. Trish Davidson states in the Gale Encyclopedia of Nursing and Allied Health that the UNOS has organ transplant specialists who run a national computer network that connects all the transplant centers and organ donation organizations. Patients are grouped in terms of priority based on how long they can live without a transplant. There is a high, desperate need for organ donation. According to New England Journal of Medicine, the demand for transplantable organs continue to increase, while the organizations involved in this procurement of organs struggle with the stagnant or possibly diminishing pool of potential organ donors. As of July 7, 2003, a total of 82,117 patients were waiting for a solid organ transplant. Internationally, the rate of organ donation varies with religious and cultural norms and the level of sophistication of medical care. Organ donation benefits both the donor's family and the recipient. When you donate your organs, you are giving someone a second chance at life that they are in desperate need of. The benefit to the recipient is an extended and improved life. In the words of Jorge Martinez, author of Family Perception of the Process of Organ Donation, many living donors and the families of deceased donors find satisfaction in knowing that their donation has given the gift of life to another person. Becoming an organ donor is very simple and can be completed in a few short steps. First, you should talk with your family and discuss your decision of becoming an organ donor. Ask your family to honor your wish if you were to pass away. The Sunday Tribune, How to Become an Organ Donor, informs us that you can register online at www.odf.org.za. On this website, you will be directed to the Organ Donation Foundation, where you can click to register yourself for a legal organ donor. Registering to become an organ donor is completely free. Another way to become a registered donor is to check the appropriate box on the form when renewing your license, your driver's license, indicating you wish to donate your organs. There are different tissues and organs that can be donated for both types of organ donations. According to Trish Davidson in her article, Organ Donation, in the Gale Encyclopedia of Nursing and Allied Health, to be a living donor, the individual cannot have certain diseases such as HIV, infection, hepatitis, or major organ diseases. The type of body parts that can be donated by living donors include the kidney, which is the most common, liver, lung, intestines, pancreas, and bone marrow. Trish Davidson also states in Organ Donation that more organs and tissues are available for organ donations after death. Organs and tissues that can be transplanted after death include kidneys, liver, lungs, heart, pancreas, cartilage, tendons, heart valves, and even veins. Organ donation is not about death, but rather life. I have discussed the need for organ donors and the importance that you could be, as well as the impact you can make in someone's life, and how they can benefit from your decision. I hope you have learned why you should become an organ donor and how your decision to do so can do wonders for people around the world, or even right here in your local community. That small, fragile 12-year-old little girl is now running around with her friends and getting ready for her very first formal dance, just because someone made the life-changing decision to become an organ donor. As Ellen Sheehy said in her study, estimating the number of potential organ donors in the United States, as the need for transplantable organs increases, waiting lists of patients become longer. We as a community and as an individual have the power to make this decision. I hope you decide to become an ultimate lifesaver.